Hey, Dr. Berg here. In this video, we're going to talk about bladder issues. So many people have bladder issues, and it prevents people from sleeping through the night, and they can't really go anywhere because they have to urinate very frequently, or it could be where they have a leaky bladder as well. And there's a lot of issues, but I want to talk about the three causes and their hormonal remedies. The first one is a low estrogen situation, and that happens at menopause because the estrogen does shift. Of course, there is a relationship between progesterone as well, but that estrogen controls something in the bladder called the trigon, which actually influences that sensation of urination. So in this situation, if it is a menopausal bladder thing, there is something that I recommend. It's called the ovary support formula as a support to the ovary itself, because I found that when you focus on the gland that makes estrogen, you can actually improve that output. This will help it if it's a lower estrogen situation or even a high estrogen, because it really works on the gland. So it doesn't matter if it's high or low. Okay, so that's the first thing that could be causing this bladder to be a problem. Number two, obstruction. There's some type of blockage or pushing or mass that's in the bladder, and that usually could be a fibroid. It could even be a prostate enlargement that can cause the bladder in a male body, but mainly in a female it's going to be fibroid related. So if there's a fibroid blocking the bladder output because there's not enough space, I'm going to recommend taking vitamin D3 at 10,000 IUs and K2 at 100 micrograms. And I would also throw in there DHA. That's a type of fish oil. Get it in 100 milligrams. And DHA is really good for suppressing tumor growth as well. And it's good for memory. It's good for the retina and reproduction. It's good for a lot of things. DHA, those three right here. And then the last thing I would recommend is a type of mushroom, maitake mushroom. Get it as a supplement, the D fraction. There's quite a few studies that show that this can help reduce fibroids. Okay, so that's number two, reducing the obstruction. And then number three, this is called the autonomic nervous system dysfunction. I know it's kind of a new term. I did a whole video on this, but I want to give you like the short version of it. The autonomic nervous system is the system behind a lot of different things in the body, especially with things that accelerate and decelerate, like stress states. When you're stressed, you have all these accelerated, you have heart rate, you have the turning off of the digestive system, the turning off of the reproductive system. And then when you're resting and sleeping, it's all digestive support. Your muscles aren't filling up with blood. You're sleeping. You're supposed to be healing and recovering. So this ANS system has to do with regulating the different body functions during stress and rest and recovery. And it controls the flight or fight mechanism. So if that's the problem, then that would be related to maybe a history of a lot of stress, and that can mess up the valve of the bladder. So this system controls the sphincters or the valves. So we have a menopausal thing, an obstruction, and a valve problem. Maybe you need to see a plumber, but to support this ANS, I recommend the adrenal support, because this supports the actual gland. The adrenal gland is actually half gland tissue and half nerve tissue. And the type of nerve it is, it's ANS tissue nervous system, because the adrenal, on the inside of the adrenal, controls the autonomic nervous system. So I gave you a bunch of big words there, so don't worry about that. Just realize that the ANS, autonomic nervous system, could affect your bladder valve, and you would want to support it by supporting the adrenal gland itself. Okay? So that's the three things that influence the bladder.